you and I have a unique relationship, Denise. So I've seen firsthand there's a lot of effort that goes into the compliance work plan, the risk assessment, and really having to prioritize hard, and also being flexible enough to be able to adapt as you identify new risks, right? And I've seen how much effort you and your teams put into those processes. And Denise is completely right. I mean, to be fair, I've never seen a compliance committee that works so brilliantly. And you know everybody, and you have a very supportive team. And I just wonder, do you have any advice about how to go about building those relationships? I mean, people seem really engaged. Your compliance committee, Denise has attendees from every department. And when you look through the minutes of the meetings, people are really engaged and they're commenting and supporting, and there's great discussion. I just wonder, any hints and tips, like how do you build that?
First and foremost, it's really leadership support. That's crucial in really demonstrating the importance of the program. And if you have that leadership, that visible leadership support, then I think that's a very good first step. So really making sure that your leadership has a good understanding of the program, what the requirements are, and why it's important for them to be engaged. I think that's probably a good place to start. But you also need to make your meetings interesting. It shouldn't be just simply, here are the results of the audits. What I find is really in making sure that we're engaging every single person in that room and asking, so what do you think? Do you have other specific priorities that you think would be appropriate? Do you have anything else to offer? So working hard with your committee members, getting good relationships with them is also another important element, and to make sure that they are indeed involved in the conversations. And again, making your agendas so that they're not just very dry, but really to allow for open discussion and dialogue.
This sounds like exactly how compliance should be. It's everybody's job. It's not just one person in one department, because when the resources are tight, everybody takes ownership, right? And when everybody takes ownership in a compliance program, it's a lot more successful. So it makes me feel the way that Denise is explaining is that, man, I bet a lot more organizations and a lot more compliance officers wish they worked in your environment, because there is that bonding that brings everybody together in all that you do, not just the care, not just the compliance, not just the regulation, but everything, because we have to rely on each other. We're a small community. We work for a small organization. We are farther from the other resources. Therefore, I take ownership on everything I do, and I'm not going to just make excellence somebody else's job. It's not just Denise's and her department's job. It's all our jobs.
Right. And
that sounds very actually nice.
It is really nice. And to build upon, helping each other, it's not unusual for us to go to other departments to lend helping hands, because patient care comes first.
They need it.
Regardless. Sure. And, if we have the training and the skills and the ability, we're going to go out there and help as much as we can. And that really goes a long way. It gains the respect from frontline staff. We've had our CFO actually doing environmental service work in our emergency department for a number of years because of, scarce resources, but recognizing that the team is small and it's important that we rely on each other to provide the best, safest care possible. I think that is one of the key benefits. That's why I really love working in a critical access hospital, because you get to experience things in other departments and services that you normally wouldn't.